COPD, or chronic obstructive pulmonary disease, is a chronic inflammatory lung disease that unfortunately obstructs the airflow from the lungs, which makes it hard for a person to breathe. To understand the disease, it is first essential to understand how exactly our lungs work. When a person breathes, air travels into our mouth, down our windpipe, into our lungs, and then further into smaller airways called bronchial tubes. There are bunches of tiny air sacs at the end of these tubes called alveoli, which expand and deflate as we breathe. Here is the process of how oxygen is transferred into the bloodstream and then discharged. COPD disrupts this process and impairs the lung function. It's often caused by a long-term exposure to irritating gases, most often a result of cigarette smoke. Some of the symptoms of COPD include difficulty in breathing, cough, mucus production, and wheezing. Sadly, people with COPD have a higher risk of developing heart disease, lung cancer, and many other conditions. It is a progressive disease, so unluckily it worsens over time. It is typically either emphysema, chronic bronchitis, or sometimes a combination of both of them. Emphysema is a condition in which the alveoli at the end of the bronchial tubes are destroyed as a result of damaging exposure to irritating gases like cigarette smoke. On the other hand, chronic bronchitis is an inflammation of the lining of the bronchial tubes, which carry air to and from the alveoli of the lungs. On the bright side, COPD is treatable, and with proper treatment management, most people can control their symptoms and achieve good quality of life while keeping associated conditions risks low. A bronchodilator is the perfect first line of treatment because it helps open the airways in the lungs by relaxing the smooth muscles around them. It will not alter disease progression or disease mortality, but it will provide great symptomatic relief. This type of medication has different types and processes and can be short or long acting. Short acting ones work quickly, typically 15 to 20 minutes, to help decrease shortness of breath, which can be prescribed as needed or just before exercise. They typically are used for treating a stable person who only has intermittent symptoms. Long-acting ones are used regularly to not only open the airways, but to keep them open as well. For this type of lung disease, the preferred route of drug administration is inhaled since it quickly deposits the drugs into the lungs, resulting in the lowest effective dose and the least side effects. This medication can be given using a nebulizer or an inhaler. To be most effective when using this type of medication, one must have the proper technique when using these devices. So how does one use a bronchodilator inhaler? First, shake the inhaler thoroughly before using it. Then, remove the cap from the inhaler's mouthpiece. Next, you want to take in a breath and exhale completely. Following, with the canister pointing upward and the mouthpiece aimed at your mouth, put the mouthpiece into your mouth and close your lips around it. Afterwards, take a fast, deep breath through your mouth while simultaneously pressing firmly on the bottom of the canister. Finally, hold your breath for 5 to 10 seconds, allowing for the medication to be dispersed into your lungs. After, you can remove the mouthpiece from your mouth and breathe normally. And that's how you use a bronchodilator. It is, however, necessary to address the unlikely possibility of side effects associated with bronchodilator treatments. But if any occur, it's important to give us a call to figure out what the issue is. The most commonly experienced side effect is a nervous or shaky feeling, but can also include things like stimulation of the receptors in the body, resulting in increased heart rate, hyperactivity, increased blood sugar levels, alteration in electrolytes, upset stomach, or difficulty sleeping. Again, it is imperative that should any minor side effect occur, that you should contact us immediately. Thank you.